Please tell us more about the benefits of this concept.
Well, skin to skin in the first hour has been researched by researchers all over the world. It started at Karolinska Universitet in Stockholm, Sweden, with Dr. Anne-Marie Woodstrom, who began this work in 1984. Since then, researchers all over the world have been interested in the benefits of having the baby close in the first hour. So we could start out with some of the physiologic benefits to the baby. For example, the baby is much warmer when he's skin to skin. And I think one of the problems that we run into as healthcare providers is the idea that the machine is better than anything else that we have. And what research has found is that indeed when the baby is in the warmer, he gets cold. Sometimes when people started thinking about skin to skin in the first hour, they thought, well, first we'll put the baby in the warmer. When the baby is warm enough, then we'll put the baby skin to skin. Well, that's not going to work. What works is to put the baby skin to skin. The baby has lower cortisol levels in the first hour and then continuing if the baby has had skin to skin. We know how important it is to have lower cortisol levels when we talk about issues like later obesity and stress and all of the things that come from having cortisol levels that are too high. And so when we think about how this is actually working for the baby in the long term, we can again look at some work by Bystrova. And what she found was that when the baby has been skin to skin in the first hour, the baby has better self-control, self-regulation, measured even at 1 year and then later even at 5 years. What does that mean? What is self-regulation? It means that the baby is better able to calm himself, that the baby is better able to interact with other people as a calming mechanism. So when the mother says to the 15-month-old or 2-year-old, don't touch, the baby will listen and have the self-restraint to actually not do that.
What if you have a sick children? Does this kind of program improve his health?
Yes. So it's up to the physician or the midwife to determine whether the baby is a candidate for skin to skin in the first hour. That's entirely the job of the medical provider. We've done some research with our colleagues in Egypt where very small but healthy babies were put skin to skin, and those babies had much better outcomes measured later on when they were in the neonatal intensive care unit. Like the full-term babies, they have better glucose metabolism if they have been skin to skin. It's so much easier to assess the baby when they're skin to skin because the baby's not crying. You can actually listen to the heart sounds. You can actually get a good listen to the lungs when the baby is skin to skin. When the baby is in the warmer and they're crying, you have to be able to listen between the crying. Here you can actually assess the baby. So let's say you have a fragile or a sick baby. What would you do in that case? Perhaps you need a better assessment. You need to put the baby under good lights, do the assessment. As soon as the condition of the baby warrants, then put the baby skin to skin and put the baby back with the mother. Even if it means that they're in the intensive care unit, as soon as the baby's condition is better, let the baby go skin to skin then.
What was the opinion of the medical doctors from Romania about this program?
I think that we saw some real enthusiasm for the program in Romania. I think that you have a very high standard of education for your physicians and midwives and nurses, and so of course they're interested in meeting the international best practice standards.
In how many hospitals from the USA is this program implemented right now?
So the CDC has given $6 million in order to implement this program of baby-friendly hospitals in the United States with the new Step 4. So it's a big program, and in addition, the Kellogg Foundation is contributing a large sum of money as well.